All right. Do prayer. Okay.
Father, we
Ready when you are, Glenn.
thank you for this day and the opportunity that we still have to get together in this way. And thank you for Rotarians all over the world and service above self. In Jesus' name, amen.
Amen. Join me in the pledge. I pledge allegiance to the flag
Where's the flag?
The United States
of America
and to the republic
for which it stands,
one
one
nation,
nation,
under
under
God,
God,
indivisible,
indivisible,
with
with
liberty
liberty and justice for all.
Those are always so fun.
I don't know why it seems so much more awkward in a Zoom meeting versus an in-person meeting. Okay, so it's 12:06 now. Thank you everyone for being here. Some club news. We'll have a board meeting next week. We'll start at 11 o'clock. Correct, 11 o'clock or 10 o'clock. 10 o'clock, and we'll use the same Zoom link that we use for this meeting. And because we have a lot of items to discuss, such as Dick Rentala is stepping down as our treasurer, so we need someone else to help us out with our accounting. And other things like of course, they just canceled the RILA, and so we're most likely just going to move that money for next year, hoping that there'll be a RILA next year, and assuming that we will not have Balloon Festival this year, and discussing other things like that. And I think that's it. Anyone else? Has Michelle anything to say? Anything news about what's going on with the club? Or
well, I'm glad you asked. So I'm going to be sending out a sign-up genius that will come into your mailbox. It'll look like it's from Plano West Rotary. And
sorry,
it's the sign. We've been providing those lunches for the homeless community, and I had signed us up for another one, and we can still do that. It'll be a little bit different because we can't get together and put the lunches together, and we'll just deliver it and let the street side showers guy handle it. So we won't be hanging out there either. So the sign up will be for you to choose to go buy oranges or bars, or to get a loaf of bread and make one loaf's worth of sandwiches. And so I'm making a sign up genius for people to sign up to do that at your own home. If there's assembly required, like washing and plucking the grapes and putting them in snack baggies or what, that sort of thing. So you get to pick what you'd like to contribute, and then you'll get with me to arrange how to get it to me. I can come pick it up from your house if you don't want to get out or can't get out that when I need to get it, or you can drop it off at my house. So we can figure that out for each one of you to get it to me. If it's the sandwiches, I need it Tuesday, May 26th, I think it is. I need it that day before because we don't want the sandwiches to go bad. But if you're doing the nuts or Welch's fruit snacks or something that's non-perishable and lasts longer, you could get it to me tomorrow if you wanted. So I'll be sending out that sign up today or tomorrow. You're on mute now, John.
oh, thank you. You hear me now?
Yes.
Oh, someone on me. We also have a sign up out there. Send me an email for Adopt a Highway. So I don't know, Glenn. I don't know how many of you have signed up. Or we have signed up for.
Yeah.
9 out of 10.
9 of 10. Yeah,
I mean, it's this Saturday, and the last I looked, there may be rain, so I'll send something out, Friday if we want to postpone it. But otherwise, the sign up shows what the new address is we go to. We're not going to be riding together. Everybody goes to one spot and social distancing is easy when you're picking up trash along the highway, so it'll be fine.
Yeah, we're going to meet at a place halfway between our endpoints.
Cool. And Joyce, you said a few things about the wellness center. Anything else you'd like to say? And news you'd like to tell us about what's going on there and what they might need?
Let me see. There we go. The biggest thing that we are finding a huge need for are incontinence supplies. So a lot of our homeless individuals, excuse me, a lot of our homeless individuals are no longer to get into facilities to use the restroom and things like that. So we've already given out everything that we have, and the most popular size is large. Very few request mediums or some extra larges, but it's typically large size, depends undergarments that individuals need. Aside from that, we're here. The building itself is closed and on lockdown, so our clients have to call us to get access into the building, and we go let them in, and then we escort them out afterwards. But we're here and providing services.
So Joy, when you say incontinence, you're talking about Depends,
Yes.
adult diapers.
Yes, adult diapers. Yes.
And as a mom who I used to take care of and is in a nursing home, very, very important, people.
Yes.
Very, very important.
We blew through the stockpile that we had within the first couple of weeks of the shutdown. So we're completely out right now.
Okay. Anyone else have any news? Alex, have any other news about this speech contest or anything else that you might want to?
I guess just given that obviously we canceled the four-way test speech contest, our club had agreed, or the board had agreed to make a donation to North Texas Pioneer so they can participate in it. Obviously, we're not making that donation because we didn't have the event. I think we've already briefly mentioned, but I think everybody in the district got the email that RILA has been canceled. Unfortunately, there has been no plans for an alternative RILA, which I'm kind of disappointed at. You know, maybe doing it over the weekends during the school year or something. It looks like they're just saying, you're out of luck, kids, which is sad because my daughter was one of them. There's basically, I don't know, I know Glenn and Michelle have been participating in the district events. Rotary International has basically shut down all travel and all events for the rest of the Rotary year, which is through the end of June. But obviously it's up to districts and clubs to decide how they're going to handle it because all areas are different. And so the district is doing a lot of things via Zoom and so on. And I guess the one last thing is relative to July 1st, that will be the first year or the first day of me being president. We will have a installation event, still trying to figure out, it's June 23rd is the date. I don't think we'll be getting together, so it'll probably be a Zoom installation event type of thing and announce our new boards. I've spoken to everybody who's going to be on the board of directors, the committee chairs. I'll be following up with everybody, seeing how things have changed because of COVID. But we've got a lot of exciting things that we have planned, and you know, Rotary continues. And as you see, we've got 2 service projects that we're working on now. Glenn, Adopt a Highway, Michelle doing the meals, and Jim has actually done a little research. And if you don't mind, Jim, can I transfer it to you? You had did some research on projects, and we didn't get a chance to talk about it last week.
Well, I contacted the Plano Chamber of Commerce, and the Volunteers of Plano has shut down for the duration of this virus and everything. But they did give me another website to go after to see about other opportunities we may have to serve the community. And some of them, most of them, have to do with feeding the homeless, feeding the destitute, the people that are walk-ins. So there's a number of websites there that we could address and look at and perhaps help them.
Excellent.
We could go into that in detail and see if there's anyone we'd want to pursue.
You know something, just my idea, kind of like what Michelle did. She took the homeless feeding and kind of converted it into Zoom. Would you mind taking a look at one of those projects and you kind of convert it into something that we can do remotely like this?
Sure.
Perfect. And just kind of let us know. We'll be able to run with it when you're ready.
All right, I'll pick one.
Thank you, Jim. I'll turn it back over to you, John.
Thank you.
Hey, John, this is Steve.
Hey, Steve.
Hey, Steve.
Can I talk
It's up
about
to-
Barron?
Yeah, please do.
Yeah, I've got a Zoom meeting set up for Thursday at 2 p.m. of this week with Michelle. We'll be talking to Joshua, who is the Barron social worker, is the things our club might be able to do to support Barron. And I'll have some answers for next Tuesday.
For
Sounds
those
good.
that have no idea what you're talking about, Steve, can you tell them?
Well, I mean, under the direction of the club, you know, I was asked to get with Barron and just talk to them about things they could use some help with during this COVID-19 situation. The school's not the way it used to be, that's for sure. And so we had talked about maybe some help in getting meals or materials to the students, things like that. So at this point, I don't know what all of their needs are, but we're going to be finding out how Plano West Rotary can help Barron. And then we do have the donation we need to give them. And I'm going to try and get a Zoom meeting set up, not necessarily for next Tuesday, but sometime soon, or maybe we can get the Barron principal on the Zoom meeting to kind of award them the money that we've got set aside.
That'd be nice if we could do that.
Thank you, Steve. For
Thank you,
those that
Steve.
don't know, Steve agreed to be our new Barron Elementary representative because he kind of has some inside scoops that he got lucky to be married to. So he's got these connections. Then he also agreed to be our program chair because he has lots of contacts. I'm probably the only one who didn't know this guy's got a podcast. And so he's meeting interesting people often. So we're looking, he's assured me that we're going to have some very interesting community business minded programs next year. So I'm not
Very
setting
cool.
you up for anything, but Steve, expectations high.
Got it, no problem. As I was under the impression I'm the co-chair of the programs, which I've agreed to help out with half the programs that we need. And that kind of leaves room for others' suggestions, and along with our incoming president's desires for maybe topics he would like to see covered as part of our meetings too.
Well, thank you for stepping up again and again and again for the club.
My pleasure.
Thank you, Steve. All right, there's nothing else. We'd like to hand it over to the Chief Blasingame from the city of Prosper, and to have him talk to us and give us a presentation about what they're doing in Prosper.
Wonderful. I'm going to share my screen if that's okay.
Yes, please.
It's reversed. I just have to figure out how to do this right here. And it's still not. Tell you what, I'm just going to do it like this. How's that? You can't seem to get it to go to the other screen. But then you're not going to be able to see it very well, are you?
I see your slides.
Yeah, you can see it, but I'm trying to get it to the other screen.
See if you go under slideshow and uncheck use presenter view and try it that way. It's going to a presenter view.
See, it's still
Okay.
together. I'm trying to figure out.
The
Under
top
the
display
PowerPoint.
settings. Or the top left.
Well, the main PowerPoint window, not this one. This is a view, right? When you get out of the view and go to regular PowerPoint,
See, Ike's our resident technology
Gotcha.
expert.
oh,
There you go.
I'll figure it out there. First of all, I just want to thank everyone for allowing me to come in today into Plano and talk to you guys. Has been a blessing, and for us, and has worked here on some interim levels and been just fantastic. And so I truly do love her as a friend. And I was kind of taken back when she asked me if I would present to you guys. But it's a pleasure to do so. So a little bit, I hope I hit on the mark of what you guys wanted, what you were looking for. Some of this is just to let you know how we're doing things and what we look at on a daily basis. And most of this information, of course, is available to you at any time. Again, my name is Stuart Blasingame. I've been in Prosper since 2002. I worked my way up through all the ranks and became assistant chief about, I guess it was around 2011. And then about almost 3 years ago now, I became the fire chief here when my former fire chief retired. I am a certified public manager through Texas State University and fire service chief executive officer through Texas A&M, and a degree in fire administration through Weatherford College. I do want to, before I even start, I want to tell you guys what a blessing it is. Your fire chief and your fire department are second to none. And I hope all of you know that. Chief Sam Greif and all the members of the Plano Fire Rescue are the best in the business. The City of Excellence definitely hits with the fire department. And so I hope that you are very proud of that, because they are a leader throughout the United States even, and on how they do things. And you could not ask for a better fire department. So Sam is a great friend of mine, and we have a great relationship. And I just wanted to reiterate that, how lucky I believe you guys are to have somebody like him and your organization there in Plano, and their department is just absolutely top notch. So some of this is, I'll tell you where we're at and where we're going, and some of the things that we look at on a daily basis. So our information resources are attached. What you see there, the Hospital Daily EM resource updates. We have a local website that we can go to and monitor 24/7. It lets us know. I'll show you some slides from it here in a little while, so you know exactly what we're looking at throughout the state of Texas when we're actually trying to monitor what's going on with COVID-19. Of course, the Texas Department of State Health Services, Department of Emergency Management, Collin County, Denton County is huge. Of course, you guys do overlap into two counties, but it seems like it's very minimal on your Denton County side. Johns Hopkins University has been the leader of university that's really, they set up the Coronavirus Research Center with just some amazing information. To be honest with you, they are keeping up with theirs probably, well, they've admitted it, ahead of the Texas Department of State Health Services. They just have more staff that they can put on it. We also look at the North Central Texas Council of Governments and communicate with them daily, and also the Disaster District Committee 4B, which is part of the Texas Department of Emergency Management. They're out of Garland. So we communicate with all of these daily. So as you're doing a Zoom call today, we run about on average of probably a minimum of about 5 Zoom calls a day, trying to keep up with this from the different organizations. For us, and it's around the COVID-19 target hazards, everybody's looking at the nursing homes. That's the hot spot, and the long-term care living centers. Hospitals are always a concern, but they are doing a fantastic job of limiting the COVID-19 spread in any hospitals. We've seen lately with Amarillo and some of the other areas a huge uptick in packaging plants, meat processing, and any areas where those workers are in close proximity to each other. And then any facility with large gathering capabilities, your stadiums, your churches, concert venues, your large office buildings, etc. So when this hit, to be honest with you, most of your emergency operations center, this was something that most people weren't prepared for. Most are ready for if a tornado hits, or like on the coast if a hurricane hits, if you have a severe hailstorm that damages a bunch of homes, fires, things like that. What we found out early on in Prosper was that one day we looked up and we had partially activated our emergency operations center, and all of my top staff were in the EOC. All of PD's top staff was in the EOC. We had our emergency management coordinator, and it hit us as we started reading about other departments catching this and it being spread, that we were in uncharted territory. What happens if one of us gets sick and spread it to the rest of the people in the room? All of a sudden, all of our administration out of fire and police and emergency management are gone. Everybody's sick. So we actually started spreading out our people. We still did a partial activation of our fire department, PD, and our EMC, but we definitely spread everybody else out. And Zoom became our world. We are Zoomed out to death, probably like a lot of you. But we literally, there's times where we're on Zoom 7 or 8 times a day, or any of the similar deals. So what we did, we came up with what we called a COVID-19 task force. It was made up of all of our executive staff, our finance department, our human resources department, and code enforcement. And the reasons being, because think about it, all this stuff is costing money. Some things that we hadn't budgeted for, and plus with some of the grant programs and things that are coming through, we've got to have finances assistance on this. Human resources, man, when you start telling people they can tell a network from home, and then people call it, sick, and using the e-sick that the state allows and things like that, and then doing some type of enforcement on some of these rules, you've got to have all these departments together. So we started every morning for about 7 weeks. We did a daily 8:30 a.m. morning briefing, where we looked at a bunch of the stuff I'm going to show you in some upcoming slides. But what we did was we curtailed that a little bit down to 3 times a week, starting last week, just because a lot of the information, to be honest with you, that we have seen at least in Prosper has been pretty flat. So we had some peaks and we've had some valleys, and then now we've pretty much leveled off like a lot of the state have. And so we've now gone to three times a week unless something major happens and we need to get back to work. It was new for us because we had never allowed people to telework, so that was quite an undertaking, but it has actually turned out and worked out very well. The production is still there, and yet a lot of these people have the convenience of doing it out of their house. And now, of course, public safety is on a different, outside of the chief officers, are all of our firefighters and paramedics and police officers simply don't have that option to telework from home. So that was one area that we could not do it, but a lot of areas in the town we could, and we felt that was important to keep them safe. We've done everything that we could to reduce close personal contact. We, for the most part, don't travel together unless it's public safety. The fire department, of course, is always, they're like a family, so they're always together in the house and even in the equipment. So it's really impossible for us to separate them. But things like public works, if they ride together, they all have to wear a mask if they ride together to a job site. When we're in public, at least in the let's say we get called to anywhere, we're always in masks. If you're out in the open field and public works is working, they don't have to, of course, then. But if they're around other residents or around other workers, they're following those conditions and wearing masks. We also did things just like Plano and many of the other centers. We closed a lot of our facilities. We closed our library, our senior citizen rec center. We have a very small rec center that they utilize. Our parks, for the most part, remained open, but what we did was all the playgrounds like that are utilized on a absolute daily basis. We closed all of those, just like was mandated by the governor. We also we give a daily update every afternoon via social media and on our web pages to our residents, letting them know how exactly pretty much where we stand, how many cases we have today compared to yesterday, and both in Collin and Denton. And of course, we are split right down the middle. It looks to me like Plano has a very small portion where you overlap into Denton County. Prosper's just about in the middle, but the majority right now of our residents are all on the Collin County side. So you'll see here in a minute, a lot more numbers are a lot higher on Collin County for the most part than Denton County, just due to population. But our western side is the fastest growing area of town that we have today. We also we provided masks to all of our employees, not only the surgical mask to do that, but we also ordered some daily masks that they can actually, now we're working on getting 2 masks per person so they can take one home and wash it, and they can always have a clean mask. So we're doing cloth masks that are reusable just to try to save because they're not real easy to get a hold of. And we now the public safety buildings, we didn't shut town hall. I believe Plano did it a little bit different, where you had to go to the front. It had to be a scheduled meeting, and someone would come and meet you and deal as much as they could outside. And if you came in, you were escorted, et cetera. Our town hall remained open, but our police and fire were closed. And then we offer masks to everybody that come in, hand sanitizer, et cetera, et cetera. But police and fire departments, we just said, hey, for right now, unless you're dropping off a package, you're not coming in the building. And even then, they're doing it in the lobby. And so it's been hard on us because we're so used to, we're a kid-friendly organization. We see a lot of babies, a lot of kids, and we've had to pretty much say, hey, no tours. We do a lot of drive-bys for birthday parties and kids' parties and graduation, et cetera, but we're just not allowing people in the buildings at this stage till we see a little bit different. I wanted to show you where you're at today, and I'm sure a lot of you guys are watching this, but I wanted to kind of show you what we look at and where we kind of get our decisions and make our decisions from. So the cases for Plano and Prosper. Plano currently has 91 cases, 277 in Collin County, and Denton County has a total of 4. Total deaths of 7. Prosper has been, we're of course much smaller. We're just under 30,000 people. So we only have 4 current cases, 1 in Collin County, 3 in Denton County. So even though the population's higher in Collin, one thing I'll tell you about Denton County, and you guys show 4, is they admitted yesterday on a conference call that they are a lot better of alerting the communities when they have a current case than they are when the cases drop off. Most of their efforts are on the current. They are trying to get to the ones where they drop off to give you an accurate current case total. But Denton County admits, just due to lack of personnel, that they've probably got quite a few that still show active cases in Denton County that have already recovered. So we're blessed. We've got we've had 7 in Denton County, 12 in Collin County, but we only have a total of 4, with 3 of those being in Collin, or 3 of those being in Denton. I mean, and no deaths. So, but one thing I want to, and I'll go through some of these, but I'm very much of a perspective guy, and it is what it is. But and I have it on a note somewhere. I'm trying to see where I put that, because I'll get to it here in a minute. And I'll tell you the percentage that Plano and Prosper actually have. I believe Plano's 0.1% have contracted it, not 1%, but 0.1% currently that tested positive in the city of Plano. 0.03% currently have COVID-19 in Plano. And that's based off of your estimate, which is just over, and I think it's probably more than that now, population-wise. The only estimates I could find were from the COG from 2019 that showed you guys at about 284 plus thousand. So that's 0.1 and 0.03 that currently have it. We are literally, we're at 0.07 that have tested positive and 0.01 that have had it. So a lot of people think when you see it, and that number sounds really high, you see 291, or excuse me, 281 in Plano that have got COVID-19. And to be honest with you, you're looking at 0.1 that's tested positive and 0.03 that currently have it. So a lot of people believe that percentage is higher, but when you do the math, that's the math. The total cases that you have here this is some from Collin County. There's been 939. This is from yesterday's numbers, with the total current cases 305. So it went up 2 yesterday. Hospitalized went down a couple. There's only 19 people in all of Collin County that are hospitalized for COVID-19. And here's one of the things on the negative test that when you're looking at some of the different things for Plano and areas that you live, it's really hard for them to get an accurate test as far as how many negative tests they've had. Positive tests, they have to notify the county health departments. But when you go to a doctor's office and it tests positive, they're supposed to notify the health department. But when it's negative, a lot of them aren't reporting is what they're finding. And so the numbers show almost 11,000 negative tests. In all reality, it's probably much higher than that. Here's just a graph that the county puts out to show you the bottom line, which is the one we were really concerned about, is the deceased line. As you can see, it is flat, thank God. The next one are active cases. And you can see it's kind of going up slightly, but for the most part, it's flat. The total cases, you're going to continue to see total cases going up. The more testing that there is, and the more positive cases you're going to get. There's a lot of people that have encountered a sickness similar to this and have just decided not to be tested. And for those people, I just say that's great in one hand, but at the same time, knowing helps us a lot. And the truth of the matter is that a lot of people, and I'm going to get to something in a minute that is just surfaced over the last week or so that we come to, it's kind of scary. But recovered, you see the recovered seems to trend almost as much as the active cases. So they're catching up. So that line's not much off, but still the percentage cases is very low for each municipality for the most part. And the deaths that we see, the majority of the deaths, every once in a while, there is something different. There is a very healthy 20, 30-year-old that you would think would never die from it, but does. But the majority of people that we're seeing as far as deaths are in their 70s, their 80s, their 90s, and the almost all of them, not all of them, but over 95% have some type of comorbidities. They've got some type of pre-existing health conditions. It's rare to have someone healthy that is dying from COVID-19, which is good. One of the things that the governor's mentioned, a lot of people don't understand. They look at the total case count and they say, well, the case count continues to rise. The case count hasn't dropped. It's supposed to drop for 14 days before you reopen the government and reopen the cities. But that's not what they're looking at. They're looking at active cases. They're looking at a big part of what they're looking at when they look to do this is just what you see in front of you. This is Collin County, and I've got some Denton County ones coming up. They look at total number of hospital beds, ventilators, and adult ICU beds. They want to make sure that they can handle that. And so one of the things that they found, this was not something that you saw on the news. And this was one of the things that really got to me because I didn't have any clue until about 3.5 weeks ago. I had our Plano has at Medical City Plano, we are under their medical direction. And our medical director who works for them also works out of Medical City McKinney. And he said, Dr. Axing, who is ours, you've got Dr. Gamber for Plano, who is He is that physicians group is one of the best in the business. That physicians group is one of the largest in the world. That physicians group filed for bankruptcy several weeks ago after this happened. So what they didn't tell you and what you don't see on the news is while New York and a few places in California and a few places where their healthcare has been taxed and overtaxed, locally, we didn't see it. And so that's why you didn't see the Kay Bailey Hutchinson Center go up, and you saw them finally, a lot of those areas, National Guard came in. Well, they released them. Same reason when you sent the ship to New York and the ship wound up leaving. Even though it was busy, you didn't see it. But in Texas and in lots of places across the country, what they did was said they thought there was going to be this huge surge in cases. So they said, no non-essential surgeries. Well, surgeries, that includes transplants and things like that. That's not including heart attacks or those type of surgeries, but a lot of your transplant lists and things like that, they laid all those people off. So most of the hospitals around here and in the DFW Metroplex and throughout the state of Texas, and even you still have several counties that have 0 cases. Well, those hospitals had to make all this room for COVID-19. By doing so, they said the only way we can do that is to stop these surgeries, the non-essential surgeries, your knee replacements and back surgeries and things like that. The hospital, even today, they're used to running around 90+%. You see in Collin County hospital beds, you're at 53.8%. So you're just over 50%. And so what happened there is physicians got laid off, respiratory techs got laid off, surgeons got laid off, your regular janitorial work, every parts of every department got laid off because they had no patients. They had a fraction of what they were used to seeing, and they didn't have the work for them. So our medical director, who's under Medical City Plano, said it is killing healthcare in the state of Texas. We're losing half our employees. And that was really, really scary to me. They, as you can see, the ventilators, and this is as of yesterday in Collin County, 70.7% are available, and 50.9 adult ICU beds are available. And so that was another. Those are some of the things we look constantly on a daily basis to see what these numbers are. Ventilators and the number of ICU beds that are given to COVID-19 is our 2 biggest factors that we're looking at when that's going to be our red flags, I guess you might say. Any questions up to now, what I've talked about? I guess everyone's muted.
Oh,
Okay.
I just unmuted everybody. I'm sorry.
No, that's okay. I appreciate it. I just wanted to make sure if anybody had any questions that I'm not going too fast, or if they want me to go back to a slide, I'll be glad to do so. So if not, I'll move on. This just kind of gives you a graph of at least on the side confirmed cases and recovered by location. And so you can see in Plano it's very low because it shows that you have very, very limited numbers. Matter of fact, I think all of Plano had in Denton County had like 4. And only 1 active. So again, cases per day, you can see back about March 25th, we were hitting quite a few more than what you see today, and it's kind of gone down there that they're showing. So it's virtually leveled off, and we're not seeing a huge influx, which is a great thing. This is Denton County side, kind of the same thing, just the different way that they chart it. So you can see occupied. 45.8% occupied. So Denton County still has over 54% of their beds available. Same thing on ICU. They've got over 58% of their available ICU beds. And ventilators, you can see that, and that's a great thing. That's what we're looking for, is that they're only using 15 out of 88 available ventilators. So only 14.6% of their ventilators are in use in Denton County. So those are the kind of numbers we like to see. Again, the key metrics, this is what we're very blessed. We have, some states are much harder hit though, and I need to say that, than what the state of Texas is, like New York, California, Washington, just to name a few of them, Pennsylvania. But we are blessed. EM Resource is what we look at every day. That's what shows us all this information that the counties use to look at their hospitals. And so what we're looking at is to see how many people are in hospitals and what they're looking at. And this is as a region. So this is the Dallas. This is made up of several municipalities, and I believe it's 16 counties. So out of this region, for what they call a trauma service area that we're under, as you can see, the total suspected COVID-19 census, they're down 10.73%. And that's great. Most of them are negative. The things that you see in positive are total available beds. You got about 1% more in ventilator use. But overall, for the most part, you've got it's on the downhill, or it's leveled off. You're not seeing much percentage differences at all. Same thing here. It's reporting numbers that show all the hospitals and the totals. Again, just different ways to look at the bed availability all the way down. It breaks it down into more detail that you would ever need. But it shows in the region how many beds are in use and how many total that we have. So that's it's just different things. So I'm going to get to something here in a second that is one of the things that is worrying us a little bit. So this just shows, again, the reporting numbers, the emergency room, the department visits over the last 24 hours. And one of the biggest things that, in Plano, Chief Greif did a deal here just a few weeks ago, and it was spot on. And it's what we found out. And I think I have a slide coming up that I'll wait and go over that here in a minute about people calling 911. So again, these just show the bed capacities, and overall, you're between 50 and 60 overall, even in the region. And so it's, I guess what these slides are supposed to show you is that, and what they do show is that we're nowhere near capacity for these hospitals. And the hospitals themselves are hoping with the non-essential surgeries coming back online that it will fill the numbers up, hopefully not with the ICU beds. And you'll see some of that because some of that's transplant and otherwise, but they need higher numbers to be able to survive. And under 50% is they're not going to survive, and a lot of people are being laid off. What you see here, the percent of occupied ICU beds, you saw a peak around the 20th of April, and then it's pretty much leveled off completely. So right now, ICU beds, COVID versus non-COVID, you can see the difference. It's very, very low, which is the blue lines on the bottom down here. That's COVID-19 ICU. People that have been told that they've got COVID-19 or tested positive. The green is every other illness that they've got that they're on. So that kind of tells you COVID-19, how that's playing into the current hospital patients today. This is something that I took off a website that Scared to Death, and that's not mine. That is MedStar in the Dallas Business Journal, but I put as a problem bigger than COVID-19. So one of the things, and I don't want to read this to you, but what's happening is residents are not calling 911 like they once called 911 just simply 2 months ago. So compared to April 2019, the number of patients who were in cardiac arrest was up 113% in April this year. What is happening there, and that's cardiac arrest. Those are people that are going in CPRs. So I'll tell you a quick story that happened to me this weekend, and I can't tell you the name of the person, but there was a very well-known person in town here in the town of Prosper, and it was 50-age-year-old person, and they started having heart palpitations on Saturday night. So they were sitting there trying to watch a movie, and their quote was, "It felt like my heart was going to bust out of my chest." So scared to death is what she told me of going to the hospital for a couple of different reasons. One, she was scared of COVID-19. Two is she was it was a female patient, was afraid that if she went, she knew her husband and her family can't go. So she put it off. and put it off until Sunday. She tried to blow dry her hair after taking a shower and lost her breath and had to stop. And finally, they called me and asked me if I'd come over and just look at her. She still didn't want to call 911, and I got there, and her heart rate was over 150 beats per minute. She could have had a heart attack at any point during the night. Now, this is a very educated, very affluent resident. Money's wasn't the issue. And she's very educated. She's smart, but she was scared to death. So we have tried to instill in people, these are things, and stroke, like same thing, the stroke symptoms, everything has, those numbers haven't gone down, but the transports have gone way down. And where I asked our medical director out of McKinney, I said, well, what have you seen in the ER? He said, we were used to seeing on average about 250 people per day in the emergency room. They're now down to about 50 that come in there. We just simply don't believe that that's gone away. All of a sudden, miraculously, no one's having heart attacks and no one's having strokes. That's why you see cardiac arrest, which is pretty much, there's very few percentages out of cardiac arrest that we get back. It has to be the right time, the right drugs, all hands on deck. Everything has to fall into sync to get a patient back. But you can see their cardiac arrest was up 113%. Of those patients, the number who were pronounced dead on scene by MedStar crews, who do a lot of rural areas, they rose 164% just since from last April to today. So these were the numbers from March. So that's one of the scary things, is that people just simply aren't calling 911 when we believe they need us, because they're scared to go into the hospital. They're scared of COVID-19. They're scared of not having their family there. One guy I talked to said, well, I'm afraid if I go in there with life-threatening symptoms, I'm going to die alone in the hospital. And that's just heartbreaking to me. But you have a better chance of survival if you call immediately. And this person I know very well, don't get me wrong, they're my friend and I'm the fire chief, but I jumped all over them. I said, are you kidding me? You laid in bed all night with your heart. You could have had a heart attack. It was like you were running full speed and you never slowed down. Your body can't take that. That's why she was just simply exhausted. So the same thing, the trends are the same across the country. And so 69% of respondents said the number of EMS responses decreased at an average of 34% or greater. So, and the reduction in hospitals are down 42%, and stroke responses, that's for heart attacks, the stroke responses were down 36%. Again, here's the problem that we have with that. So if you know somebody or you're out there, those numbers haven't gone down. It's the people have not gone in. And what I tried to explain to this person is the same that I would explain to my family, is that if you have these symptoms, it's imperative you call. If you call right now when you experience them, between us and the hospital and the surgeons and the cardiologist, we have a great chance of it not killing your heart muscle, or you being able to return back from a stroke, them to give you medication to help that stroke, where you've got some chance of recovery. If you don't, and it's that part and you are having a heart attack, that heart muscle, that part of your heart's going to die. And when it dies, you can't get it back. It's just gone. It's dead. And so you have a smaller portion of your heart and you have problems the rest of your life. Again, this is what it shows today on cardiac arrest cases. And that red that you see on the top is up there simply because people aren't calling 911. Again, the COVID-19 daily statistics, here's what you see here. The new cases, this was as of yesterday, the new cases were 21, recovered was 605. They got active 305 in the entire county. And then in Town of Prosper, we're fortunate in Collin, we've got one confirmed case. And out of, we had a total of 12. We've only got one currently with 11 recovered. And the same thing that you see there for Denton County. We had 4 recovered, so we only have 3 in Denton. This kind of shows you the lines, another that we're looking at, the COVID-19 cases throughout town, and this kind of tells you where we're at. Most cities, even though the numbers are higher, like in Plano, they're seeing a very, very similar graph between cases and active and recovery. And this is the hospitalized patients in the entire region. And that's good numbers, because if you look all the way back to April 30th was 611. It dropped a little bit down, and then you see it dropped off a little bit in the first part of May. But we're not seeing that increase, which is good in the entire region. We're actually seeing decrease. We went up to, in the last few weeks, up to 676 just as of May 9th, and now we're down to 530. And so that's what we want to see, is this continual decrease in the hospitalized patients and the others. This is your counties, and Collin and Denton are the ones you'd be concerned with, but the lab confirmed COVID-19 patients that are actually in hospitals. So again, in all of Collin, they're showing 55 patients, 26 in Denton County. The ventilator stats, same thing out of the entire region. They're flat and going down a little bit. The Collin County vent use has gone up just a little, and we've been told some of that is due to some of the surgeries. Because keep in mind that a lot of those elective surgeries, which I didn't know this, liver transplants and kidney transplants, I figured those were essential surgeries, and they're not. Those are considered elective. And so you're going to see a little bit of that as the numbers in the hospitals go up. The same thing on the ventilator stats. They're actually down on the Denton County side. As you can see, they've actually reversed, and they're on the right trend. They've only got 2 patients in all of Denton County with COVID-19 on a ventilator. And with that, I'll be glad to take any questions that you got. I hope I didn't bore you too much with some of the graphs, but I do want to emphasize our concern with not calling 911. We're there when they need us, even if Plano's no different than we are. We're not in charge when we go out and we look at somebody or check on somebody. But I fear that people are not calling because, just like the resident that I know very well from, there's a lot more like her, which is why we're seeing these numbers increase. And for me, it scares me, because I don't want people that I know, and I never thought that would happen. I don't want people that I know not calling when they need. Let's face it, you're not going to get healed at home from a heart attack or a stroke. You're not. And it's got to take some kind of definitive, somebody else to step in and to help you surgically or medically, medication-wise, something. And you're not going to get that sitting on the couch thinking, I'll wait till tomorrow, or I'll wait till it gets worse. That's why you see more people dying from it.
A question, where do we find the hospitalization COVID stats that you were showing a minute ago? Because that's something that my wife and I would like to watch ongoing. She watches those statistics closely, and if we could see the hospitalization statistics are much more accurate and meaningful, I believe, as you've outlined, to really have a sense of what's going on. And I'm going to have to take a lead.
Collin County, Judge Hill's got, he sends out a deal. You can actually sign up for his email that he sends out every night. But to be honest, it's just a duplication of, and I will be glad to send that over to John, and if he wants to share those links where you can just click on it and get to their COVID stats. They're typically dated, Collin and Denton both, between about 4 and 6 o'clock every day. They update those, and so you actually can see it. But again, I think most everybody, including myself, until I saw these, I thought, man, hospitals have to be overwhelmed. I thought, nurses and doctors and then I find out people are being laid off left and right out of the hospitals, and I'm like, how can that be? And then I'm going to be honest with you, not doing the math. When I first heard about it, when we first had, at one time, I think we had 8 or 9 at one time cases. And I thought, to be honest, I thought that the percentage was much higher, I guess, on how many had it. When I did the math, I was like, wow, 0.06%. It's not that bad. Robert,
I have a question.
Sure.
So if you go to Dallas to get tested and you test positive, does that show up on the Dallas's numbers or the Plano numbers?
It's where you live. So what happens if you test in another county, and here's been kind of what the deal is. Collin County really hasn't done a whole lot of drive-throughs, and all of those have been private. Denton County just now, because they didn't have enough tests. So over the last week and a half or so, Denton County started doing a couple of drive-throughs, mainly in the Louisville area. They're doing another one, I think, this Friday at Braswell High School off of 380. But you have to be symptomatic, or you have to be an essential worker. And so Collin County hadn't done that. And it used to be, why aren't the fire departments publishing out when a private facility like a doctor's office said, hey, I've got tests, I can do you, and we can have you come in here and do it. Well, what happened was people started doing that, and almost immediately they were running out of tests because everybody was hitting that office so quick. And then people were mad at the municipalities for sharing it and going, well, 2 hours later, I went there and they didn't have any. So a lot of your regular doctor's offices and stuff can test for it now. They have a small number of kits. You're starting to see more and more hit the market. Like I said, Denton County got a lot more over the last 2 weeks, and where they started doing their own. The last I heard from Judge Hill in Collin County, in that area, they simply weren't looking at doing any type of drive-throughs. Most have been going to Dallas County or a local doctor's office. And then if they test positive, but like you said, if you go to Dallas or you go to Denton County and you test positive, by law, they are supposed to notify the health department in your county of residence and say, I have a resident at this address in this community. And then in turn, they notify a very choice due to HIPAA. Even my firefighters don't know where our positive cases are. There's about a choice 3 of us that it goes in our computer-aided dispatch. It's an alert that we put in there. So unless they get called to that address, nobody knows throughout any of these deals, unless those people themselves say, hey, I have COVID-19, and you know them. That's the only way you can find out.
So do the private offices, do they report exactly the same way the health department does?
Okay, here's what we found out. Yes, by law, they are instructed to do so. So a couple of weeks ago, I believe it was Friday before last, you saw a considerable jump in Collin County and across their area. Somehow, there was some information that had, and a lot of it was from the smaller offices. So all of a sudden, you saw it go from an average of 18, 19 a day, in some places 15 a day, to 45. And people went, oh my God, we're opening up the communities and we just had our highest peak. Well, that's because more tests were put in there and more positive tests some of them weren't that, it didn't happen that day. It happened over a period of a few weeks, and they dumped it in the system on that Friday. And that's why the Texas Department of Health Services admits they've had some lag in getting some of the information in there, because just like when they notify the county then has to notify the state. And so it's a kind of a trickle effect, and it takes a while for everybody to be notified of that.
So that was really nice and very helpful. One of the things you can take away from this, there seems to be, capacity available. Luckily here, where if people got sick, the system can take care of them. But I think the reason they probably don't advertise that, because the infectious stuff like this is exponential, right? So if you have 25 bed available, that may be just one person getting infected and spreading it out. You know what I'm saying? It's not linear. 25 bed doesn't mean, one person can wipe that out if they spread it out, because it's exponential.
It is exponential, but what you'll see is there is a lot of room in every hospital. Most hospital beds aren't 50% occupied right now, and some of these hospitals are very large hospitals that don't have it. So one of the things that I do like that Governor Abbott did was that no matter what, for instance, elective surgeries can be done but 15% of their overall ICU beds or beds have to be restricted for COVID-19 patients. So if you have a hospital that has 200 beds in it, 30 of those beds have to be for COVID-19. So they, even though as you'll see the hospital demand increase with now that non-elective surgeries have come up, they have said until further notice and until he changes his executive order, there is going to be a percentage of COVID-19 beds available in every hospital, period. So if those hospitals get to that level, then what they will be required to do is stop. They'll have to say, hey, on a non-essential surgery, no, you can't book because you can't put that patient here. We have to have this much room. And so that is a lot of things that, to be honest with you, that is a lot of what the hospitals are looking at and communicating on a daily basis. And I got to be honest with you, sir, I was shocked when I heard from a hospital the size of Medical City McKinney that their hospital is wasn't even 50% occupied when he talked to me. And he said, yeah, people don't realize how many, because everybody thinks this is going on and we've got all this medical staff. What happened was a lot of private. I actually have friends. My wife's an RN. I've got friends that are RN that signed and went to New York because New York was hiring people by contract, paying, 4 times the amount what an average nurse would make to get them to come. And here they were laying them off. And I couldn't believe that. I thought, you can't lay off a nurse during a pandemic. You can't lay off any hospital employee. Well, that's exactly what they had to do because they couldn't afford to stay open. And that really, I guess, to be honest, that shook me up a little bit. I was kind of like, that's something as a fire chief and looking at all these numbers daily and trying to think, just like your department does, of how do we protect our community and how do we protect our residents and how do we keep them safe. I didn't ever take that into consideration, that all of a sudden there was a decrease in staff in the hospitals. And so I'm hoping that gets back to some sense of normalcy to some degree, because that's the last thing we need during a pandemic is for some of these smaller ones that can't afford to do it, then to shut down because they can't do it. And so that was, to be honest, that scared me. I was like, that was the first thing I heard that really I went, oh my God, everybody's worried about having enough capacity. And then we look and the hospitals are in the 40% and people are being laid off. So not that we want, we don't want to see COVID-19 spread. And just like we're doing social distancing, masks, gloves, and I have a different opinion on gloves. Gloves are great if you wear them correctly. Gloves are great if you do the right thing, but if you don't, you're no safer and probably worse off than you were. A lot of people, hand sanitizer, I love, and masks, wear all the time. I don't wear gloves a whole lot because you touch things you don't realize you touch. And I'm tired of seeing a bunch of gloves in the parking lots. I think it's disgusting. And I see people driving down the road in their gloves. Don't do that. You just contaminated your car, your door handles, everything. Take you some sanitize and wipe. If you want to wear it in the store, wear it. Take them off, throw it in the trash, sanitize your hands, and then. But there's safe ways, and unfortunately, a lot of people are not using the PPE like it's designed to be utilized, and therefore, I'm not going to say making matters worse, but they're not helping themselves.
I personally don't understand why they don't put a garbage can at a grocery store where you put the carts up. Some do. It's just like common sense. If you don't want it all over your parking lot, put a garbage can there.
So the problem is that what people are doing, in my opinion, is they're stripping them when they get to their car. So I went to Lowe's has huge garbage cans at each exit, each entrance, and you go out there in a parking lot, and they're either in the parking lot. Same thing with masks. I don't know where they're getting all these masks, but you go and you see, because we had trouble finding masks for a while, but you see them in the parking lots and
I can help you with that.
areas, and I'm like, just throw it away, But again, it's sad that we have to be reminded to have good hygiene.
Chief, I've got a question for you.
Yes, sir.
I really appreciate this presentation and a lot of great information. especially specific to Collin County. Can you tell me, given our positive rates for the cases and hospitalization and deaths, what are you seeing on the horizon for social distancing and reopening?
Okay. You have to understand what if I go there, I'm speaking from opinion,
Exactly.
not fact. And I have a difference of opinion on that. And the reason I have a difference of opinion on that, and I want to go back a few slides. I actually know people, and I want to say this, and let me preface before I say anything else. I want to preface by saying my opinion, and this is Stuart Blasingame's opinion, is if you're symptomatic in any capacity, if you're sick in any capacity at this point, I don't care if you think you've got allergies. If you don't know for sure, stay home. Stay isolated from people around you. Do not get out. Continue to check your temperature. Continue to do all the other things. I know people that never thought they would be in a food line. They had to get in a food line over the last month. I know people that thought they were doing great, had great jobs, and got furloughed. And now they're worried about how they're going to pay their rent, how they're going to pay their utilities, how they're going to feed their families. And I hesitate to tell you this, but I tell anybody that asks me, and I'm not really ashamed of it. I look at this and I say, and even with Plano being higher, 0.1% in Plano have tested positive, not 1%. And that'd be 1 out of 100. If somebody gave me odds on anything of 0.1%, you know, if somebody said, hey, at 99 chance out of 100, you're not going to get this, you'd go, that's pretty good. Well, this is 0.1. And in Prosper, it's 0.01. It's 0.07 as far as testing positive, and 0.01. And I look at the deaths that Plano's had. Most have been elderly with pre-existing conditions. And we've had 0 deaths. And I see people struggling. And I think that to some degree, we've got to get back to returning to what we do. At the same time, for at least now, we can't do things like we did them. We need to continue to try to minimize, you know, our face-to-face interactions and shaking hands. And I'm a handshaker. And more than that, LaShawn will tell you, I'm a hugger.
Same.
You put a hugger and all of a sudden tell them you can't hug, you can't even shake a hand. I was in withdrawals for a few weeks. And I don't like that, but it's necessary. But I'm also one to believe that if I was in that percentage and you said, Stuart, you can't work, but currently in your municipality, you have 0.03 like Plano has that currently have COVID, I'd be like, you're not going to tell me I can't work to feed my family with 0.03%. And so when you see a lot of people upset and angry, and then you see the flip side, a lot of the people at first are, a lot of those people that are saying, oh, we have to do this, they're not hit as hard. Now, there are some exceptions that will say, hey, I lost my job, I did this, but I'm not getting out. And I believe it is your prerogative. If you do not want to get out, you do not feel safe to get out, simply don't get out. If your immune system's not good, you have some immunodeficiencies, comorbidities, you've got some pre-existing underlying health conditions, my recommendation would be to limit it as much as you can. And when you do, wear a mask, take your hand sanitizer, use places that are listen, if I've got a choice to go to somewhere and they're sanitizing their carts and the handles and things like that versus a place where you're kind of on your own, guess where I'm going? I'm going to the place that's doing their due diligence to try to limit the spread. But at the same time, I look at the numbers and I'm like, if 10% of our population had it, absolutely, everybody needs to stay home. But I'm looking at 0.01 and I'm like, that's really hard to tell somebody don't go to work and don't feed your family with 0.01%.
So what do you think about social outings? Like, for example, our Rotary Club. You know, we have to decide when we're going to start meeting together. You know, I talked about earlier, I have my installation event on the 23rd. Do we plan for it to be a get
I hate to tell you this, Alex, but those are decisions that you have to make. And what I would say, like for instance, our council, for like yesterday, I'll give you a choice. Some of the people that look at this as much as I do, and trust me, I look at this from morning to evening every single day. And I can tell you right now that yesterday, the Collin County Commissioners Court, they met in person. Now, they spread out. They tried to stay 6 foot away at lengths from each other. There are some that are trying to do that. There's some that are believing, like we have some council members here in town. They want to go back to the council in the chambers. They're going to separate the people out. They're going to ask for people that aren't family not to sit together and try to keep 6 foot separation. And they're going to do their best in the council chambers to do the same. We have one or two that may not be comfortable with that or have some underlying health conditions. They have the right to use Zoom or anything else they want to try and protect themselves. So at some point, I think it's like I told my firefighters, I said, you're all smart individuals. And I have news for y'all. For you guys donating, volunteering your time and doing what you're doing, all of you have a level of education that you can decide what you believe is safe for you. And that's what I tell people. If you don't feel safe doing it, you just answered your own question. If you feel like, hey, you know what, looking at the data, I'm not concerned about it. Still my recommendation would be to still do your due diligence to try to keep some social distancing and continue on. But again, that's got to be up to each individual and what they feel. I tell people, I love my friends that say, hell no, I'm not going out. I'm staying home. And I love my friends that say, hey, I'm going to eat. And I support both sides of it. I think there's arguments for both sides. I just simply don't think there's a one size fits all that fits all of us.
Thank you.
So one thing, and I know it's hard to quantify, is let's say, we go to a meeting and we do social distancing. If somebody has it, you could probably inhale some number of viruses, but nobody talks about quantity. It's different to sit in front of somebody who's bombarded you with millions of viruses. I mean, we always inhaling toxins. It's just the
absolutely
quantity. But nobody talks about that. So, I don't know.
That's not the topic. That's not what anybody cares about. You could say, I got the flu from somebody, and somebody be like, oh, okay, that's not a big deal. But you tell somebody I got COVID, okay, and they're running. They're running for the hills. And so you're absolutely right. There are many different things that people can get from one another's, and that's been the case our whole lives.
Okay.
That has never changed. But much like anything, this pandemic, do we want to see it? No, we don't. We don't. Any death is hard. If it's your family member, it's awful. But my problem is that I look at 7 total deaths in Plano, and like I said, this is my opinion. And if you have your own opinion, I cherish it. I believe everybody's entitled to believe their way. But since you're asking me, I look at it and go, I would want to know, out of those total 7 deaths, what was the populations? Were they nursing homes? What was their, just about everything that comes across our desk. They don't give you a whole lot of information. They'll tell you, I saw a deal the other day, and no offense to anybody, it may have not been this gentleman's time to go, but I saw a 92-year-old male with pre-existing underlying health conditions. I hope to make it to 92, and I'm sorry for his family, and I'm sorry for him, but would he have died anyway is my question. The epidemiologists can't tell us that. And so if they have it or have had it and they pass away and have had COVID-19, it's a COVID-19 death. And so a lot of them that I'm looking, if I was seeing a bunch of, to be honest with you, the most people that are getting it are in the 30 to 50, or not 30, 40 to 60 range. But those majority by far are recovering. The deaths are mostly in 80s and 90s and some of the upper 70s, but just about, it is so rare to see one come across my desk that says passed away with no underlying health conditions. And so that's my thing. I sit there and look at it and go, and due to HIPAA, they won't tell us a whole lot more than that, but that'd be my thing.
The challenge we have, the majority of our Rotary Club has pre-existing conditions. And at 54, I'm the third youngest in our Rotary Club. And so we have older members, and almost everybody has pre-existing conditions. And so trying to make a decision whether we meet or not, it's a heated decision.
And you may find out, Alex, that even if you meet, that it might not be the full complement. It might be that the people that you feel comfortable with, or yourself, or anybody else that feels comfortable meeting in spaces do so, and you continue to have the in by Zoom. So nobody's missing anything, but the ones that want to do it in person, still, there's some people, we fear a lot as well, and we've seen this. And a lot of people don't have this problem, and so it may not be happening to you, but it doesn't mean it's not happening. The psychological toll that this is having on a lot of families. Our attempted suicide rates are way up. The suicide hotlines have reported that they're more than double where they were a few months ago. I can tell you, we just in our town of less than 30,000, we've transported a couple attempted suicides just in the last week. And so I hear it on radios all day long across the counties where that's happening. Child abuse has gone way up. Which is hard, domestic abuse has gone way up. I hate to say this, DWIs have gone way up because you got a lot of people out there that are drinking more because they're trying to deal with it, in my opinion. And that's not to say, I'll be honest with you, for the state of Texas, Prosper you want to talk about Chamber of Commerce here. Prosper from Kroger has the most alcohol sales in the entire state of Texas. With Benny Keith. Kid you not. And so I've got a good friend who works for Benny Keith. He said, you're not going to believe this. Preston Road Kroger is the highest selling distributor of alcohol in any Kroger in the state of Texas. And it has gone up considerably in the last 2 months. It was number 5 before, but we're number 1 now. So, but those are things that scare us, is the mental side of this just as much as the physical side of this, with what it's doing, and with some people that are losing their homes and their livelihoods, and a lot of them that were heavily invested in the stock market took its toll and things like that, and people are thinking there's no way out, and you just have to ride it out. I mean, I tell people, man, we'll help you any way we can. You just can't give up, when things are down.
Steve, I know you're super busy and your time is very valuable. I appreciate all this time you're giving our club. But I do want to ask one question. We've got a number of requests to get access to the recording of this Zoom. Do you have a problem if we make access to the recording or even put it on our website?
No, I don't have a problem with that at all. Again, you may find people that completely do not agree with me. The numbers that I showed you are public numbers from the counties. And from the different municipalities or the different organizations, the Texas Department of Health, et cetera. So they're what you could already find online. So no, I'm perfectly fine with that. I just preface it by saying, some of this was my opinion, as I told you up front. And I believe everyone's entitled to their own opinion, and I don't argue with anybody about it. I just simply, as I said earlier, I believe that one person, this pandemic doesn't have a one-size-fits-all.
Well, on behalf of Rotary, I know that Sam Greif, Greg Russian, they're both longtime Rotarians. I know the Prosper Police Chief is a member of the McKinney Rotary Club. Are you in Rotary?
I'm not. I've been going to some of the Rotary meetings here in Prosper, but I'm looking at that, I promise you, here in Prosper.
Got to put the screw in you.
I know. It's okay. It's okay. Some of my good friends are, and some of them that you just mentioned. And again, I thank you guys so much for your time and letting me kind of tell you our side of things. And to be honest, I was kind of surprised because it was for Plano. And LaShawn said, hey, it'd be nice to have a different perspective. And I love this area. I love this community, and it was close. And I do want to tell you again, though, man, you guys are blessed to have the fire department that you have, and I believe you're equally blessed with your police department, because I know several of them as well. And but I'm know more about the fire side of things, and you just couldn't ask for a better fire department than what the city of Plano has. And you're blessed to have them and the leadership of Chief Graff, no doubt about it.
Well, Ed Drain and Sam Greif are in different Rotary clubs, so they're not invited. So we told
that surprised me. Sam said y'all had 5. I was like, 5?
We have 6 actually.
6, okay.
So we told LaShawn said such great things about you, so we were excited that you were willing to come speak to us. So now now that you've been here, maybe we'll let Ed or Sam come talk to us in the future.
Anything you need, and I tell everybody, I try to be, I'm an open book. There's not much to. I've already passed when I could have retired, so I pretty much say what I want and do what but I can do that. I don't want to do that yet. But again, a lot of this is factual that I gave you. Some of it was strictly opinion, and I just can't say that enough. I respect the fact if you say, I think it's too soon and we should stay closed, and I encourage you not to get out if that's the case. But I also don't argue with the people that say, I can't do this anymore. I've got to get out. I've got to get back to some sense of normalcy in my life. But again, I would continue. The counties that we live in, we're very blessed. And even though Plano's majority in Collin, similar to us, but you still have some in Denton, those county websites, and I'll be glad to send it to John, they are phenomenal with information every day. And they're an open book. So you see what we see. We just have to dive into it a little bit further. But I'll tell you, anybody your family members that need to go to the hospital there in Plano, just like us, they are very, very thorough with decon and their PPE and what they're wearing. And it's for their safety, but it's also for yours. And I would not hesitate at all to call Plano Fire Department or Prosper Fire Department if I was feeling ill to go to the hospital.
Thank you very much.
Thank you, Chief. It was a lot of great information. Thank you for your opinion as well. And I know we all appreciate it.
Wish you all luck, and I can't thank you enough for inviting me. And I know some of it might have been a little bit bored. I was trying not to kill you with PowerPoint, but a lot of that information I thought was pertinent for you to see.
No, it was good for some of those who don't get the information. I know I've been getting the emails, but I know some may have not, so they can now they can go get those. It has a lot more information than what you put on there too.
Yes, sir. It does. I could have killed y'all. We could have been here till 5 today with PowerPoints.
Yeah.
There's a lot of information out there. And what I'll do, John, I'll send you the county links. If you want, I'll also put on, which I think is a good link, the Johns Hopkins University link.
Okay.
There's a lot of good information on there as well that you can actually see nationwide, or you can dive down into just Texas or even further down into that. But there's a lot of great information on those links that you can get on a daily basis that's updated.
Yeah, that'd be good for us to put on the website and to share.
You got it.
Awesome.
All right. Thank you very much.
Thank you
our
all.
meetings,
Have a great day.
We usually end at 1, but it was such a great presentation. We let it go to 1:30.
It was worth it.
It was worth it.
It was. All right, we finished off the meeting with the 4-way test of the things we think, say, or do. First,
is it the truth?
Second,
is it fair to all concerned? Third, will it build goodwill and better friendships?
And fourth,
will it be beneficial to all concerned?
Rotary.
Thank you.
Y'all have a great day.
Thank you.
Thank
Bye,
you.
everybody.
Thank you. Bye.
Bye.